Hi, this is Steve Rowe, Executive Director. Today is Wednesday, November 4th, the day after Election Day. I'm recording from Oak Knoll East today, sitting in an apartment. I needed to come over here to just check on some things and talk with Steve. Everybody here that has moved in is very happy with their decision, and things are going really well. I actually just ran into a resident on my way into the building who was taking her dog out to the dog park for the first time. So kind of a neat experience. We're not used to having dogs in the hallways that live here. I guess we've had some visitors, but we are now a pet-friendly community, at least in parts of our campus, and just a new development for us. If you're at all like me, this is kind of an uneasy time for us, I think. We're used to going to bed and waking up and knowing who the president will be. Just seems like a lot of uncertainty right now. It kind of is amazing to me that we live in a country that is so technologically advanced, but we don't know how to count votes as quickly as the technology certainly would allow. But we are where we are. We're in the waiting game, and we'll deal with whatever the consequence is. So I don't really have anything to add there, so I'll stop talking about it. We've had a lot of communications to our residents this week, unfortunately. There have been 3 separate communications by the time you watch this video. On Monday, we decided to restrict visitor access again based on the case counts in Johnson County. When we looked at it and updated our tracking sheets on Monday, we had 10 consecutive days in a row of increasing case counts. 12 of the past 14 days had increased, and the case counts were more than double where they had been in early September. So kind of frustrating that we're going backwards with that. And I think we needed to do what we did. Many of you have sent notes of either thanks or appreciation. Haven't really heard from anybody who was too upset with that decision. So I guess it is what it is. We needed to make that decision to try to keep people as safe and healthy as possible. On Tuesday, unfortunately, we had another communication that went out, and that was related to an exposure of one of our dining services staff members. And we've got, unfortunately, several people within the dining services department who are out on quarantine, and we just weren't able to continue to operate with all of the dining venues open the way that we would like to serve you. So we made the decision to temporarily close the Third on Third restaurant in order to utilize the staff that we have as well as we can and not spread people too thin. Obviously, it's like things like dining venues are a little bit of a luxury and discretionary. There are also things like our health center that we don't have the luxury of closing. So there are certain things within the universe of our services that we can either temporarily suspend or close down for a little while. But I just want you to know that all of our efforts are going towards planning and thinking about how do we make sure that the most vulnerable and dependent of our residents are cared for and with the appropriate staff. So there is a temporary CNA, Certified Nursing Assistant course. There's an 8-hour course that many of our employees have taken so that they would be able to help out on a temporary basis in our health center center if we had a number of health center employees who weren't able to come to work either because they were sick themselves or were quarantined from a potential exposure. So that was the Tuesday development, and Tuesday was also a day that we did our weekly testing, and unfortunately, I'm saying unfortunately a lot in this video, and I'm sorry for that, but it's just again our reality. 2 of our employees tested positive with the weekly COVID testing. Both of those individuals worked in the health center. They had been negative for the test last week and then positive for the test this week, and they had worked in the health center between those 2 testing periods. So because of that potential exposure to our health center residents, we do need to test all of the health center residents, and that will occur every 3 to 7 days until we have a period that goes by where there's 14 consecutive days where we have no positive tests from employees or from residents. We continue to have no residents who have ever tested positive, and our belief and hope is that this will be another situation where we do the testing of our residents, and because the employees have been using the personal protective equipment appropriately at all times, that no residents will test positive. But we won't know that for probably a day, maybe 2 days from now. The testing is occurring, the labs are being drawn, or samples being taken to send to the lab, and it should be 12 to 24 hours before we have the results of those tests back. So that's what's happening with COVID testing. Looking forward, because of the positivity rate in Johnson County, our employees will now need to test on a twice-a-week basis, so every Tuesday and every Friday in the lobby of the Spring Building. That's really our testing center, and so it's we've got a couple of nurses set up there and taking samples to do those tests from our employees, and we will have to do that twice a week until the positivity rate for Johnson County drops back down below 10%. I also want to tell you, we will continue to communicate with you as clearly as we can and as quickly as we can. There has been a lot going on this week, and it feels like we're sometimes chasing our tails trying to get the next message out. But just know that our intention is to be fully transparent, to tell you the truth, and to do that as quickly and as clearly as we possibly can. So that's the standard that we have for ourselves, and I think by and large we've lived up to that standard for you. We're just a couple of, 3 weeks away from Thanksgiving now, and I know that's on many of your minds. Our hope is that between now and Thanksgiving, we get a nice downward trend in cases, and that we're able to open back up for visitors so that you'd at least be able to have a couple of family members come to share a Thanksgiving meal in your apartment with you. I don't know if that will happen. None of us can know, but that's certainly our hope. If you choose to go out of the building and spend some time with your families at Thanksgiving, it's totally understandable. And I just really want to encourage everybody to be as safe as possible. Small groups are better than big groups. There is transmission that's occurring even with small groups. So that's the challenge, is nobody knows for sure that they have it or don't have it, other than I know, it's right after I've had the weekly COVID test, I'm pretty sure that I don't have it in that moment. But no, I could be exposed 6 hours later and not be tested for another week. So all of the people that I interacted with over the course of those several days could potentially have been exposed because I didn't know that I had been exposed. So it's just a really challenging situation for all of us. I just encourage you to keep doing what you are doing. You are the primary reason that we haven't had any positive cases with our residents, because you have kept distance, you have washed your hands, you have worn masks, and stayed home a lot. So it's where we are. We will get through this together, and we are all doing the best we can to keep you safe and healthy. Thank you.